they found that, first of all, what Latino or Hispanics? Does anyone know the difference between Latino and Hispanic?
I'll take it down, right?
Please.
Hispanic is more from Spain, the word that the people that came from Spain, so they use Hispanic because there was a mixture of the Indians and the Spaniards, and so they're Hispanic. And Latinos is more from Latin. And I know that a lot of people are offended by Hispanic because they have a problem with the Spaniards coming over. And
the conquistadores, yes.
And so they would prefer Latino. They feel like that's more politically correct.
Exactly. Hispanics, like Anna said, Hispanics come from the term, actually, Hispania. Hispania used to be called the Iberian Islands, like Spain and Portugal. So these are we call the Spaniards. So Hispanics were basically people that spoke Spanish. And you know that in not all Latin America, not all people speak Spanish. You have the Brazilians that speak Portuguese. You have French Guiana that speak French. You have some people that are from the indigenous Mayans descendants, they speak Mayan. Paraguayans speak even another language. So it just, Hispanics don't really cover everybody, and also some Hispanics get offended because it reminds them of the Spaniards that came to Latin America, and in their mind they destroyed their indigenous cultures. So they think about the Spaniards as conquistadores, that basically they demolished all the indigenous Indian culture. The Latinos, like Anna said, because they come from Latin America, Latin and South America. So that's the difference between them. And you will have people that will be offended if you call them Hispanics. They prefer to be called Latinos. And Hispanic is not a gender. Hispanic is basically everybody. And Hispanic were actually created by the US Census in the late 1970s, 1980, to try to put the group of people from Spanish descent together. So for the census, Hispanics are not a race. But for the Department of Justice, it is a race because that's how they kind of control the human rights laws. So Hispanic is not really a race, it's more of an ethnicity. And there are people that like to be called Hispanicos, and that kind of put them together. They feel that this is their ethnicity, this is their unities. So you will have a lot of names, and that's why it's very important that you ask the person that you're dealing with as, how would you like to be addressed? A Latino. And Latino and Latina has gender. Latino is for a male, and Latina is for a female. The same as Chicano and Chicanas. So we have Latinos, Hispanics, Chicanos, and we have Mestizos. Mestizos are basically the mix between the indigenous people and the Hispanics. And then we have the mulattoes. The mulattoes are the mix between people from African descent and the Hispanics. These are the difference. And also there are the Caribbean region that are, some of them are Hispanics, and they don't under Hispanics or Latinos. So they're called Caribeños. So it's a whole different story, and that's why you have to ask that. Like when you go to the Middle East and you call everybody an Arab. You know, and I tell you for a fact that Egyptians are offended when they're called Arabs, because they're not Arabs. You know, so it just like, or call the Middle East, everybody together. And the Middle East is like, it has the Levant countries, it has the Gulf area, it has Egypt on its own. So everybody likes to be, is proud of who they are, and they like to be called who they are. And then the political views. The Cubans are more Republicans because their views are more conservatives, so they're more or less in line with the Republican Party. The rest, like Mexicans, the Dominicans also are with the Cubans and Republicans. The rest of the Hispanics are more or less Democrats. So because they are a little bit liberal, a little bit, they go in line with the Democratic Party. Again, please understand that I'm not stereotyping anybody. It just are just general points that where at least we need to start. So I'm not saying that every Cuban is Republican, and I'm not saying every Mexican is Democrat. You have disparities. Whenever there is a minority, and why do we call a group of people minority?
Their numbers are smaller than the...
That's one factor. What else?
Usually things are kind of against them, that they're somewhat not.
These are protected classes.
Yeah.
These are protected classes, not minorities.
Oh, okay.
The minorities, women are minorities. The number of women are 60% now in the United States. So it's not numbers. Minorities are not numbers, it's power. The power and socioeconomic effects. That's what minority basically means. It's not really numbers. And a lot of people are under the impression that minority is just numbers. No, because the simple fact is that women are a minority, but the numbers of women are 60% of the US population. What else do we need to? So whenever there is a minority, there is always health disparities, because whenever there is their socioeconomic levels are lower, and a lot of Mexican Americans live below the poverty line. So there will be a lot of health disparities. Like we see, most of them do not have medical insurance, and I'm sure that you see that every day. But they don't have medical insurance, and then the healers that they use, and their culture, and their fatalismo ideas that we're going to be talking about in a second, they don't really seek medical advice or medical treatment, but you see them double in emergency room. Because they wait till the end till it gets really bad, and when they really have treatment and go to the emergency room. So we have diabetes is very high in the Mexican American population. Asthma, HIV, and AIDS, and infant mortality, high infant mortality rate are in the Puerto Rican. There is lack of prenatal care. And then there is obesity, high blood pressure are mainly, you see them mainly in males of Mexican American origin. And they have a problem controlling their blood pressure, because again it comes to the culture. Because they believe in now and que sera sera, that we're going to discuss in a minute. They feel, if I feel good now, why should I take a pill? God is here, God will take care of me. So why should I take a pill? First, that is expensive. Second, that might give me side effects. I will not take any pill till I really feel that I really need to. That's why the blood pressure is not really well controlled. The obesity is a factor. There are low rates of vaccination. People that live on the border, especially around from here in San Diego and Mexico, they have a high rate of infectious diseases. So we see a lot of, we see TB, hepatitis. Between the Latinas, they have a higher rate of teenage pregnancy than their counterpart that are Caucasian. And they have high rate of cervical cancer, drug abuse, and the teenager or the Latinas, the young Latinas, have one of the highest rate of suicide. So.